This is my psychopathology Bpss midterm. I did my midterm Bpss on a client I've been working with who I'm going to refer to as VD. She is a 14-year-old Caucasian female who is in 9th grade at a public high school. She's an immigrant from Belarus. She moved to the United States at the age of 8. She lives with her biological mother, stepfather, who she refers to as dad. However, I'm going to refer to him as stepfather just to make things more clear, and younger half-brother. And she does not communicate with her biological father, who still lives in Belarus, and she is currently receiving mandated treatment. VD was referred to residential at Hillside from an acute psychiatric care following her 4th suicide attempt in the past 9 months. The reason for referral is she's severely depressed. She has high levels of hopelessness and worthlessness. This is her 4th suicide attempt. So her first was an attempt to overdose on allergy medication. Her second was an attempt to overdose on stepfather's medication. The third was self-mutilation on one of her wrists. And the fourth was drinking bleach in a Target bathroom. And she also engages in self-mutilation on her upper arms. The reason why this is a crisis immediate referral is VD continues to need 24-hour stabilization and care, and she's at imminent risk for suicide. So the treatment expectations are to decrease suicidal ideation and build a life worth living. And the role of social worker while she's at Hillside, she'll interact with a variety of social workers who will engage in a team, and they will partake in treatment planning, individual therapy, family therapy, DBT skills group facilitators, discharge planning, and advocating for VD. So VD's presenting problems. She's got recurrent suicide attempts. So within the past 9 months, she frequently engages in self-harm behaviors with razor blades. And typically she steals razor blades from Target and hides them in her room. History of binging and purging 1 time per month and restricting calories, feelings of hopelessness and worthlessness, high level of anxiety and stress, and this is particularly for school and relationships, and withdrawn from family interactions, and anhedonia. So, appearance for her mental status exam, appearance was unkept hair and clothing. Her hair was tangled and clothing was dirty. Behavior, cooperative behavior, as evidenced by engaging in discussion. However, she had poor eye contact throughout. Speech was normal, volume and rate. Her mood was depressed and her affect was flat. Her thought processes were normal. She was oriented to place, person, and situation, but did have difficulty with time. Cognition, her memory was not impaired. She was able to answer some questions and able to focus. Insight is fair to the situation, and judgment, though, is poor and impulsive. So for suicide risk level, I broke it up into 3 different stages because throughout my time working with her, she received different care. So at admission, it was high risk, history of suicide attempts, report suicidal ideation, and reported plan, mean, and intent. In residential care, the reason why I put it to moderate risk is she did have intent and plan, but there were no means for this because she was watched and the means weren't around. And in PHP care, I put moderate risk. She had the means, but throughout PHP, she denied intent and plan. So for family history, she lives with her mother, her stepfather, and younger half-brother. Mother and stepfather married 6 years ago here in the United States, and half-brother is 5 years old. She is estranged from her biological father, who still lives in Belarus. And the client and mother left Belarus when VD was 8 years old. The mother reports suspected alcohol abuse of biological father, and client reported suspected abuse toward the mother. However, this was not confirmed. Family medical and psychiatric history. So biological mother has a history of depression. Stepfather has a current diagnosis of depression and is on SSRI medication, and that was the medication VD used for her suicide attempt. Mom, stepfather, and brother all participate in Hillside's in-home services and family therapy, and biological dad has suspected alcohol abuse. Social history and current issues. Family reports a strong connection with family friends who shared the same cultural background as them. And VD reports that her two best friends are daughters of the family friends. Family dinners with the local grandparents on the weekends. VD is in a long-distance relationship with a boyfriend. Parents report that VD's moods fluctuate based upon boyfriend's mood, and she will engage in self-harm when the parents do not allow to see her boyfriend, and she will also threaten to stop attending therapy and taking her medication when they do. VD and her boyfriend do have an inconsistent relationship, so there were times when they were together throughout treatment and times when they were on a break, and boyfriend engages in self-harm behaviors as well, and VD and her boyfriend will communicate that to each other when they're self-harming. VD disclosed desires to be in a relationship with another male who's also receiving treatment at Hillside during the times when she was on a break with this boyfriend. So medical, substance, and legal history, there were none reported from medical. She denied substance use, and legal history, she has stolen razor blades from Target, but there are no criminal charges. Psychiatric history is pretty in-depth. So in May 2018, that was her first psychiatric hospitalization. And at school, she researched lethal dose of SSRIs, and at home took her stepfather's prescription. She called her mother. She was admitted to psychiatric care. And when she was in care for this attempt is when she disclosed to her parents about trying to overdose on the allergy pills back in January or February of 2018. In August of 2018, this was her second attempt of suicide and try to get hospitalization. She did not want to go to school, so she slit her wrist. However, her outpatient DBT therapist evaluated her and did not hospitalize her, and rather referred her to Hillside's intensive in-home therapeutic services. And then December of 2018 was her most recent suicide attempt. And in outpatient therapy, she denied suicidal intent, and then stated that her and her boyfriend had an argument, and that was when she went to Target and in the bathroom drank 4 gulps of bleach and texted her family and told them, saying, "I've been a bad daughter." And she was rushed to the hospital, didn't need stomach pumping, and was hospitalized. And then from there, she was hospitalized to our residential center. But in January of 2019, she was transitioned to a lower level of care through our partial hospitalization program because she was denied from insurance to continue with residential. And then in February 15th, she was discharged and referred out. So for trauma history, she disclosed sexual abuse to her parents right before coming to Hillside Residential. And she has never disclosed this to any professionals during any intake assessment. She informed her parents it happened when she was 9 years old. and the perpetrator was a friend's father, but this sexual abuse has not been confirmed or reported to DFACS yet. She does not have any reported developmental delays. For spirituality and religion, she doesn't report having a religious affiliation or spiritual connection. However, her mother reports following a Christian faith and stepfather is Jewish. Cultural implications. So VD, she resides in a residential setting at one point, which entails key card access for all doors. She is constantly watched 24/7. She's also an immigrant from Belarus. She's a member of a blended family. Does not communicate with her biological father. However, she does voice that she would like to eventually talk to him. She engages in self-harming behaviors. She is a part of the adolescent culture, and more specifically female adolescent culture. And she is a child of parents with depressive disorders. So her risk factors are that she has a history of multiple suicide attempts, her ineffective relationships with others, specifically males, her power struggle with her parents, access to means, and her emotional sensitivity. And her supportive factors would be her supportive parents who are committed to treatment, the healthy, strong relationship she has with her brother. Upon discharge from Hillside, she presented good insight into the relationship barriers with her parents. She has a supportive community, access to psychological resources, and she is adherent to treatment. So for diagnostic impressions, she came to Hillside with 2 previous diagnoses. However, the principal diagnosis I gave her was major depressive disorder, single episode severe. And the reason why I gave her that rather than the recurrent episode that she came with is because there has not been an interval within her depression. In the unspecified bipolar, she did not exhibit or present any sort of mania or hypomania. So that's why I gave her that principle. And for provisional, I selected borderline personality disorder based upon her presenting problems and her history of treatment, relationships, self-harm, and suicide attempts. So for her genogram, you'll see she's got a variety of relationships and connections. The skating rink is a strong connection for her. It's a good coping mechanism for her. However, school is very stressful. Her boyfriend they have a strong connection, but it's unhealthy. And her dad, she does have a strong connection with, strong supportive relationship with. However, it is pretty stressful as well for her. And mom, she doesn't feel a strong supportive relationship from, just that stress. And then her brother, her therapist, Hillside, and friends and family, she reports to have a strong supportive relationship.